Good afternoon, ladies and gentlemen. I'm James Dickson from a company called Piotr Apps. Piotr stands for Put It on the App. We're a mobile-first company. Our products are mobile apps for phones and tablets, iPads. And they are designed to assist self-management of patients at home in a safer way, so that you can, they can take care of themselves better, be in your care less, but in a safe way. We think the three things that are needed for self-management to be successful and safe are the patient needs to know enough about their condition and what to be monitoring and so on in order to look after themselves well. They need to have confidence that the information that they've been told is authoritative and correct, and they need to have help on hand should they require it. If you take those different factors, then these are some examples of apps which we've provided to NHS services around the country. This really addresses the confidence issue. The way it works is a patient will present to a clinician. The clinician will say, please go to your app store, download our app. On this app, we have put a load of local information, national information, and other resources to help you when you go out of here with your condition. So left to right, paediatric diabetes in Edinburgh, type 1 diabetes in Aberdeen, maternity, respiratory, COPD, and so on. The badging in the local services, colours and logos is important. Again, it means that it's their local service. They're being provided with an app delivered by the people who are treating them. You can get on an app these days, anything you can get on a website, email, letters, and so on. So, and you can configure the app, these apps, they're customizable. So you can configure them how you want. And therefore, each service can design its app to be intuitive for the person to use. And on it, you can house all the information which they're going to need to have. And it's in one place rather than being dispersed across several sources. On the right-hand side, push notifications are very important for apps. So you're able to use the app to send updates, information, reminders, good news stories, motivational messages, and so on, to people on the app with a push notification. So it's going to ping on their phone when it arrives and alert them to the fact that something new. You can do that either to everybody with the app or to groups that you set up on it, or individuals. And lastly, there's a feedback channel. This plays into the safety aspect I'll explain in a minute. Here are some examples of the sort of groups that you can create on the app. Here, these are for the patients to opt in to what they want to be notified about. This is a way to prevent them being bombarded by excessive messages which are not relevant to their condition. So on the left-hand side, there's you're either a pen user or a pump user, for instance. You sign yourself into those. On the right-hand side, that's a public health service app on different conditions. Feedback. So you can create feedback forms on the app, send them out, and get them back. They're very, very fast to create. This is an example from a training session of a diabetes service for the new device. You see the questions on the top. The questions are along the lines of, sorry, it's so small. The things like, has the session met your expectations? Was it too long, too short? What's the information provided about right for you? What's most useful? What was least useful? And so on. And so it takes about 5 minutes to create such a survey. In the case of this clinic, they had 2 or 3 clinics over the course of 3 months. This is captured here. And so you get all these answers back from the people with surprisingly rich information. So they're explaining to the clinicians what was lacking in the information. I didn't understand this. Could you give us more information about that? And so on. And also what was good about it as well. So the response from the clinicians is, OK, we'll put more information on the app, which is relevant to the stuff which they said was missing. And we will, over time, get a better and better product for them. With an app, you get an analytics package, which will show you the number of downloads of the app, the daily usage, the viewers, and all that sort of stuff. So that enables you to evidence it internally and measure the effectiveness of it. Anecdotally, the main comments we get from the clinicians are the bottom one there, which is that it's very easy to change information on the fly. So what the patient has is that mobile app you saw. What you get as a service is a website where you go into that website, type your information to there, cut and paste stuff in, put in pictures and videos and whatnot, and then publish it to the app. So it's real time by you. You don't have to send stuff off and rely on somebody else publishing it onto the app instead. So it's very responsive and very quick. Their app won the QIC Diabetes Awards. Their main comment, the judges' main comment, was the fact that they were able to target these messages at specific groups of people. This is very good for engagement. You know, the best way to turn people off is by sending them far too much stuff about things which are not relevant for them. So a quick summary of what the product does. If you're using a combination today on the top line there of email, paper, text, handbooks, and so on, phone calls to try and track people down, an app is probably a better way. It's definitely a better product for the patients, the families, and their carers, because it's all in one place. It's on their phone. They've always got their phone if they're out and about or if they're at home, wherever. And it should save you time and cost because you can streamline these different media down into one channel. They provide you with feedback. And on the bottom left there, there are the examples of things which the app definitely achieves today: person-centered care, digital transformation, and so on. Continuity of information for them. On the right-hand side, there's no proof of these yet. It's too young. Our first app was installed about 18 months ago. But the clinicians are certainly hoping and trying to measure whether it has an effect on things like delaying onset of conditions through better self-management, reducing admissions to hospital or to care, and also earlier discharge through hospital. If you can make more people more confident that when they go away, they're going to be in good hands and looked after, then that's the idea there. So the patients will generally say it makes their life easier. It's a sort of one-sentence response. And for the NHS service or department, it's all about it's better patient experience for sure, and it saves time and cost. You can also use it for internal communications as well. So for the public one like this, we're discussing normally all the information on the app will be public information, so no GDPR issues at all, and you make it available to anybody who wants to download it. If you want to use it for internal comms, you can do all the same functions on it, but you can put a registration system on to prevent anybody outside your organisation downloading it. As a company, most app companies will do this. They'll offer a free trial of an app. So on the left-hand side there is an example. This is Edinburgh, the Paediatric Diabetes Department up in Edinburgh. This was version 1 of the app, which we supplied to them. The logo was correct, the title was wrong, and the sections were wrong. And so they tested internally. It takes 1 or 2 hours to test it. And they come back and say, we need it reconfigured this way, please. So we do that for them. That's another couple of days. Normally within a month of time, during which you've spent about 3 or 4 hours of work actually uploading and editing stuff on the app and sending out messages, because you've enlisted colleagues and patients, whoever you wanted, to download the app in the meantime to help you test it. Normally after that period of time, you'll have a good idea whether it's going to be useful for you or not. Cost. Our background as a company is the world of schools. So we do these apps for schools, for communicating between schools and parents, 400 schools, 10 countries. And we've always priced it off the basis of the size of the school, essentially. So we've copied that in these initial days in the NHS. So if you think of your patient population, if there are 500 or less who come through your door in the course of a year, the price of that app would be £1,500 per year. It's a flat fee and a setup fee on top. And if you're a bit bigger, a higher price and so on. You only have to pay the price after this free trial, so you get all the free trial beforehand, and only then, if you decide to go ahead, do you actually pay anything at all. On the legal side, all the content on the app is entered directly by you. No content on the app can come from us or from patients or anybody else. No comments or anything like that will come on the app. So you're the data controller of this. You're responsible for that information. And we, as the app company, are responsible for keeping the app performing well. So we do regular updates of it, version releases, keeping it current with the platforms and so on. And when you need it redesigned and adapted, we do that. That was all. So thank you very much indeed for your time. I was going to try and hook an iPad through the system here to show you a live demonstration, but I can't do that. So, but we're on a stand over there, so if you're interested afterwards, I'd love to speak to you then. Thank you very much.